So a self-myofascial release for the adductors. Now the adductors' role primarily is adduction. It's basically bringing the leg back to the midline. They do play a role in hip stability, maybe kind of a little bit of hip flexion, extension, a little bit of rotation of the femur as well, but primarily they bring the leg in. Now the way you're going to do this, you're going to bring yourself onto the ground and take a foam roller. If you can, use one of these thin, long ones, which is smooth. In my experience, these are superior to any other foam rollers out there. So what you're going to do with this one, you're going to go face down, as you can see. Now from here, one leg is going to come out. I'm going to rest the roller just on the inside. Now from here, again, what we're telling you to rotate your body slightly towards the roller. So if you go perfectly face down, you may feel the lower back jam up slightly, just because it's getting a little bit compressed. The way around that is slowly rotate out. Now from here, just like all of our self-myofascial release techniques, I want you to very gently just scan through the tissue, nice and controlled. Now what we're looking for here is points of discomfort. Now bear in mind, you're not driving your leg into the roller, you're just letting it rest. So once you find a small spot that's uncomfortable, as always with these myofascial release techniques, so I've got one point, just probably about there, we're going to settle into it. I want you to control into this. Now this can be quite a sensitive area. So as you can see, my foot's on the ground here. What you can do is bring your foot back and rest it on the roller if that makes it a little bit less intense for you. But the aim is to get the leg down, as you can see. But nice and steady, you're controlling your breathing into this, just holding onto that one spot. Nice controlled breathing. Now, once you've held this around about 2 minutes, because don't forget, we want to create a change in the tissue in that area. So what the holding does, it actually starts to focus on down regulating the nervous system's perception of that particular area. Now once that discomfort fades away, all we're going to do from there, very subtly, still pinning the leg on, we're going to shift the leg up and down very slowly. Now bear in mind, I'm not rolling my leg on this, I'm just shifting, pinning the tissue down and shifting. And it's not a large movement. It's not a large movement, very slowly. You're going to do that 5 times. There's one, and you get the picture. Now when you come off the roller, I want you to take the leg very slowly off. So this in turn, it's not going to cause the tissue to really kind of fight back and tighten more so. Do this on both sides, and when you do this, if this is part of your corrective program, you're only going to focus just on that one spot. So let's say I find a spot here, I work on this. After that's eased and I've done my kind of 5 shifts up and down, I'm not going to find another place. It's just that one spot, then switch sides. So as always, give it a go and let us know how you get on.